long, short, bouncy, or sleek. For most women, hair is way more than a bundle of fibers. It's an expression of your style and personality. But if you start to lose your hair, it can really freak you out. Many people think that hair loss only affects men. However, it is estimated that more than 50% of women will experience noticeable hair loss. The most significant cause of hair loss in women is female pattern hair loss, or FPHL, which affects about 1/3 of susceptible women, which equals out to some 30 million women in the United States.
What are the types of hair loss?
Well, there are three: Anagen effluvium, Telogen effluvium, and Androgenetic alopecia. Anagen effluvium. This is caused by medications that poison a growing hair follicle, like chemotherapy. Telogen effluvium. This is caused by an increased number of hair follicles reaching the telogen phase, which is the stage where hair falls out. Androgenetic alopecia, or female pattern alopecia or female pattern hair loss. This type is the most common. Hair thins over the top of the head and on the sides.
What are the signs of hair loss in women?
Seeing more hair fall out daily, either on your brush, on the floor, in showers, on your pillows, or in the sink. Seeing noticeable patches of thinner or missing hair, including a part on the top of your head that gets wider. Seeing scalp skin through hair having smaller ponytails. Seeing hair break off.
What are the roots of hair loss?
There's no single cause. Triggers range from medical conditions, as many as 30, to stress and lifestyle factors, like what you eat. Your genes play a role, too. Sometimes doctors can't find a specific reason. As a starting point, hair loss experts suggest you get tested for thyroid problems and hormone imbalances. Hair often grows back once the cause is addressed.
Hair loss trigger.
Thyroid problems. This butterfly-shaped gland at the front of your neck pumps out chemicals that keep your body humming along. If it makes too much or too little thyroid hormone, your hair growth cycle might take a hit. But thinner locks are rarely the only sign of a thyroid problem. You might lose or gain weight, become sensitive to cold or heat, or notice changes in your heart rate. Polycystic ovary syndrome, or PCOS. If you have polycystic ovary syndrome, your hormones are always out of whack. Your body makes more male hormones, or androgen, than it should. This can cause extra hair to sprout on your face and body while the hair on your head thins out. PCOS can also lead to ovulation problems, acne, and weight gain, but sometimes thinning hair is the only obvious sign. Alopecia areata. Alopecia areata causes hair to fall out in big patches. The culprit is your own immune system, which attacks healthy hair follicles by mistake. In most cases, the damage isn't permanent. The missing locks should grow back in 6 months to a year. Some people lose all the hair on their scalp and body, but that's rare. Ringworm. When the ringworm fungus affects your scalp, it triggers a distinct hair loss pattern. Itchy, round bald patches. They might also look scaly and red. Your doctor will treat it with antifungal medication. It's easy to spread by direct contact, so check your family members for symptoms too. Childbirth. You might notice your hair seems fuller during pregnancy. That's because high hormone levels keep resting hairs from falling out. But after the baby comes, things go back to normal and those strands will fall out quickly. You could lose a lot of hair at once. It could take up to 2 years for your locks to return to normal. Crash diets. You may lose more than weight with a fad diet. And if you drop 15 pounds or more, you might also shed some hair a few months down the road. Don't worry too much. It'll return when you're back on a healthy diet. Be prepared to shed some locks if you're getting too much vitamin or not enough protein. Tight hairstyles. It's no myth. Wearing cornrows or tight ponytails can irritate your scalp and cause hair to fall out. The same goes for using tight rollers. Let your hair down, and it should grow back normally. Be aware that long-term use of these styles can scar your scalp and lead to permanent hair loss. Cancer treatment. Chemo and radiation therapy, two of the most widely used therapies, can take a toll on your hair. In their quest to kill cancer cells, both can harm hair follicles and trigger dramatic hair loss. But the damage is almost always short-lived. Once your treatment is finished, hair usually grows back. Extreme stress. High-level physical or emotional stress can cause you to suddenly shed huge amounts of hair. Examples include serious illness or major surgery, trauma involving blood loss, severe emotional distress. The process may last 6 to 8 months. Medicine. Minoxidil or Rogaine is approved by the FDA for female pattern hair loss. It can slow or stop it in most women and may help hair grow back, but the benefits go away when you stop using it. Corticosteroids can help regrow hair for women with alopecia areata, and if the cause is an underlying medical problem or poor nutrition, your locks should grow back on their own once things are under control.
How to treat hair loss in women.
Lasers. Devices that emit low-energy laser light may help new hair grow. They're available in some clinics and for home use. Several are approved for both men and women, and studies show they do work. but it might take 2-4 months before you see results. Keep in mind, the FDA doesn't require the same rigorous testing for devices as for medicines. The long-term safety and effects aren't known. Hair transplants in women. This procedure involves moving hair to thinning scalp areas from fuller areas. The trouble is, female pattern baldness causes thin hair all over, so good donor sites may be limited. It works better if your hair loss comes from male pattern baldness or scarring. Hair loss products and devices. A quick internet search will turn up dozens of products designed to stop hair loss or regrow hair. Unfortunately, there's no way to know whether before and after pictures have been doctored. To figure out if a hair loss treatment really works, check with a dermatologist, the FDA Medical Devices Division, the Federal Trade Commission.
How to handle major hair loss.
Of course it can be a challenge. If thin areas are easy to spot, consider a weave, a hairpiece, a scarf, or a hat. Good quality wigs are more comfortable than ever, and they rarely have bad hair days. Hope this video will help you. But if hair loss affects your job or social life or makes you not want to leave the house, talk with a counselor, or just simply go directly check out the description of this video.